chronic kidney disease and symptoms of chronic kidney disease. These are the topics which we have already covered in this series about chronic kidney disease. Today we are going to discuss more about chronic kidney disease. Namaskar. This is Dr. Suniti Khandekar, an MBBS clinical nutritionist and MBA hospital administration, author of 3 books on renal nutrition, and we are here today on Valentine's Day to discuss how to love ourselves, how to take care of our body, how to take care of our kidneys, so that we stay strong and we are able to be strong for our loved ones. So let us begin more about chronic kidney disease in this series about chronic kidney disease in Indian diets and kidney diseases. Let's begin. So in more about chronic kidney disease, let us first discuss about the causes of kidney failure. Now, the main causes of kidney failure in India as well as all over the world is diabetes, which is uncontrolled. Uncontrolled diabetes is the main cause of chronic kidney disease or kidney failure in general. Then we have chronic kidney disease of unknown origin. We don't know the cause, and it is often a late diagnosis, and that is the reason why the kidneys fail. Frequent urinary tract infection is another cause, wherein there are infections in the upper urinary tract, which involves mainly the kidneys and the upper ureter. High blood pressure, uncontrolled blood pressure, which leads to spikes of high blood pressures frequently all throughout the day, may lead to kidney failure in general. Glomerulonephritis, where filters are damaged. Now we are aware that the kidneys are made up of so many filters, and these filters are damaged in case of glomerulonephritis, which is the main cause of chronic kidney disease or kidney failure. Kidney stones, another problem. Bilateral obstruction, when both the kidneys are obstructed or both the ureters and the kidneys have been blocked by these kidney stones, then that may lead to kidney failure. Hereditary kidney diseases like polycystic kidney disease. These are the main causes of kidney failure, especially in India as well as abroad. So, what are the CKD risk factors? Chronic kidney disease risk factors: diabetes, hypertension, obesity, family history of kidney disease, smoking in general, old age, protein loss in urine, autoimmune diseases like lupus. These are the chronic kidney disease risk factors. Now, if a patient is already suffering from diabetes over a long period of time, he may land into chronic kidney disease. Or if the patient has hypertension since very many years, if the patients are obese to the extent that the basal metabolic rate is low and the BMI, that is body mass index, is too high, then those patients are at a risk of kidney failures. Family history, smoking, so we need to control smoking. Chronic kidney disease complications. Most patients do not have symptoms until the kidney functions are moderately to severely impaired. Now, even then, even they make normal or near normal amount of urine, but it does not contain sufficient amounts of body's waste products. That is most important to diagnose the CKD stage and the complications further. So edema, that is swelling of feet, ankles and legs, loss of appetite, increased sleepiness, nausea, vomiting, confusion, difficulty thinking are all the symptoms and signs of chronic kidney disease. We have already discussed about this in our previous topic, which was specially covering the symptoms of chronic kidney disease. High blood pressure, anemia, high potassium levels, and bone disease are also the complications of chronic kidney disease. Uremia, a group of symptoms which includes loss of appetite, nausea, vomiting, fluid around the heart, confusion, dizziness, drowsiness, changes in mental status, and even coma. These are the complications which chronic kidney disease patients may land into. So we need to be careful. Now, how do we evaluate chronic kidney disease? Kidney functions test, the first and the most important and the easiest way of diagnosing or evaluating a patient of chronic kidney disease, in which eGFR, blood urea, and serum creatinine, estimated glomerular filtration rate, high blood urea, and high serum creatinine are seen in patients of chronic kidney disease. Urine tests. Routine urine tests done in routine laboratories check for the presence of albumin or protein in urine. Imaging, that is ultrasound. So ultrasound or CT to check for blockages in the urinary tract in case of any kidney stones, or large cysts in case of polycystic kidney disease, which is the hereditary type of kidney disease. So these are the three ways in which we evaluate any patient of chronic kidney disease. Now, how to take care of our kidneys? Today being Valentine's Day, let us love ourselves, love our kidneys, and take care of them. So 7-point strategy to protect our kidneys are: blood pressure control. We need to control our blood pressure. If a patient is having hypertension, then the spikes of high blood pressure or even say low blood pressure may cause damage to the kidneys. So a steady blood pressure is always welcome in such patients. Sugar control, weight control, sugar control in case of diabetes. Blood sugars, fasting and post-meal need not have high spikes. If they are in a controlled manner, steady state, then it protects our kidneys. Weight control, because we have already seen that obesity is a causative factor of chronic kidney disease in the long run. So we need to control our weight. Infection control, most important. We need to take care of ourselves. We need to be very careful in what we eat, which water are we drinking, or whether the hand wash technique is being properly followed in case of before eating or after coming home from outside. Matters the most in case of chronic kidney disease and protecting our kidneys. Stress control. Who does not have stress? Nowadays, a kid of pre-nursery, kindergarten also has the stress of finishing a task or a project or an exam. So stress levels need to be maintained right from childhood. There are ways and means of controlling the stress, or at least preventing it from damaging ourselves, by ways and means of meditation, say yoga, or listening to the music, or gardening, painting, or doing some activities which you like, and they help you control your stress. Malnutrition prevention, most important. We all are aware that in India there are certain regions which are malnourishment zones, and the government is trying its best. But how do we prevent this malnutrition from happening? That is, we need to take in good quality food, home food, mainly proteins, carbohydrates, fresh fruits and vegetables in our daily diet, in order to prevent this malnutrition and in order to protect our kidneys. Lifestyle modifications. Quit smoking. Smoking has been listed as a causative factor for chronic kidney disease in the long run. So smoking, alcoholism, tobacco chewing, and other wrong kind of lifestyles which are there, that needs to be controlled, and thus we can protect ourselves and protect our kidneys by this lifestyle modification. Sleep at the proper time, get up at a proper time, reduce your stress, reduce your gadgets before going to bed. It reduces mental irritability and stress in general, and that is the lifestyle modification which we need to have in this era. So dietary interventions in chronic kidney disease. What are the dietary interventions? Salt restriction mainly, which helps to control the blood pressure. So we need to restrict our salt intake at least try not to have salt shakers on the dining table. Try not to add additional salt in an already cooked vegetable. Try not to add salt in the chapatis or the parathas or the rice. And try not to add salt to the salads. This can help control blood pressure in the long run. Proteins. Restricting proteins to 0.6 grams per kilogram body weight may help delay the progression of chronic kidney disease. But we Indians are already pure vegetarians or semi-non-vegetarians, as we can call ourselves, and thus we need not completely stop eating proteins. Rather, the plant-dominated low-protein diet, which consists of dals, pulses, sprouts, and lots of vegetables and fruits, are said to be protective in case of chronic kidney disease, or preventing the progress of chronic kidney disease from stage 1, 2 to 5 and the stages of dialysis. Potassium needs to be taken into consideration. Potassium restricted diet with low potassium foods and leaching of vegetables, pulses and dals needs to be done. But of course, looking at the blood potassium levels. So it is not a blanket statement that all dals or all vegetables need to be leached. Secondly, it is not a blanket statement that every patient needs to leach the vegetables or not eat the kind of fruits that he is eating. It depends on the blood potassium or the serum potassium levels of the patient. So do check your blood biochemistry and maintain a record as to what are your sodium levels, potassium levels, phosphorus levels, calcium levels, and have the diet accordingly. Phosphate. Now, in early cases of chronic kidney disease, body retains phosphate. And as it progresses, the phosphate levels go up. So dietary phosphate restrictions are recommended, and you need to see a qualified nutritionist for phosphate restricted diet, because all diets which have got phosphates in it have got protein in it and also have got potassium in it. So the protein, potassium, phosphate balance needs to be maintained. The P3 balance needs to be maintained, and that is the reason why take help of a qualified nutritionist while planning this kind of diet, and just don't just follow any diet, because protein is very important in case of chronic kidney disease. Cholesterol and triglycerides. So high triglycerides are associated with increased risk of cardiovascular diseases. So dietary changes, strict sugar control in case of diabetes, smoking cessation in case of chain smokers or those who are having obsession about hookahs, and medications may be used to control cholesterol and triglycerides. And these are the dietary interventions in case of chronic kidney disease. If you wish to know more about Indian diets and kidney diseases, we have our 3 books. Indian Diets and Kidney Diseases in English, किडनी का स्वास्थ्य हिंदुस्तानी स्वाद के साथ in Hindi, and किडनी से आजार आणि भारतीय आहार in Marathi. Take care of your kidneys. Love your kidneys. Bye-bye.